All right, perfect. So we are recording. All right, so hi everyone. My name is Andrew Sepiol. I'm a third-year medical student at the Medical College of Wisconsin, Central Wisconsin campus, and I'm very happy to have Dr. Kevin Thao here today, a family medicine physician working in Wautoma. So, Dr. Thao, can you tell us a little bit about yourself and where you practice and what drew you to the Central Wisconsin area?
Yes, thank you, Andrew, for having me on tonight. So I practice in Central Wisconsin primarily because I really love the community here. I grew up in Wausau, Wisconsin, and so after graduating high school, headed off to Madison to train in medical school as well as family medicine residency. And as my wife and I were looking for a place to kind of set down roots and raise our family, we could think of no other place than where we both grew up in the community here in Wausau and in the Stevens Point area. So we decided to come back here and take care of our neighbors and our community. And since 2014 have been spending our time doing that.
Fantastic. And so, can you tell us a little bit about I guess the Hmong community in the Central Wisconsin area, and describe your practice with Hmong patients?
Mm-hmm. Yeah, so even as I was a student in the University of Wisconsin School of Medicine and Public Health, I became very interested in healthcare in diverse communities, and one of them being the majority Asian community in Wisconsin, the Hmong community. And I had a little bit of advantage in that I am of the community, so I am a Hmong physician. And despite that, though, I found that there are some unique challenges that physicians face when working with the Hmong community, partially just due to demographics. The Hmong are a new immigrant and refugee group to the U.S., only arriving here in like the 1970s after the Vietnam War from Southeast Asia, from a country called Laos primarily. And so the community had not had a lot of exposure to westernized medicine. And in the 40 years that the Hmong have lived in Wisconsin, the community continues to interact and grow in its closeness to westernized healthcare. But because of that unfamiliarity, there can be some challenges, especially in like preventative medicine, primary care, preventive screening of like colon cancer, breast cancer, cervical cancer, those kinds of issues. In addition to that, some of the community and social characteristics are just a little different than mainstream American communities. And the fact that the Hmong, coming from kind of an Eastern Asian cultural background, put a very high importance on social cohesion and putting even individual desires below the benefit of the community. And so in this kind of like more social environment, the ideas of autonomy and individual choice can be a little more challenging to discuss with patients. But otherwise, I find that the Hmong community tends to be generally a healthy community, especially young individuals who are, again, just growing in their respect and use of westernized medicine. There are some disease challenges in terms of this thing the epidemiologists like to call the demographic shift, where individuals of the community are becoming more and more afflicted with the chronic diseases, things like high blood pressure, diabetes, cholesterol, high cholesterol. Our members are now starting to experience higher rates of diabetes and things like heart disease, as well as cerebral vascular events, strokes, as compared to the general community. And so this is something that's kind of alarming to some of the health professionals that serve the community. We're currently investigating this. We think similar to the demographic shifts that happen to individuals who come from a primarily agrarian society where most people used to farm for a living, to arriving in a very westernized society, just the changes of life, perhaps some of the genetic changes and epigenetic changes that have occurred within one generation for the community may be affecting some of these higher rates of chronic disease. But even now, there are programs in the community that are aimed at educating the members, especially the elders who are afflicted with diabetes, about diabetes and measures that they can take to stay healthy, as well as prevent some of the secondary problems that come along with these conditions once they are diagnosed.
Fantastic. I can imagine that it would be difficult, coming from Laos and Central Southeast Asia to be exposed to just such a different culture, but then also a very different healthcare system. Do you feel like it's more challenging sometimes for Hmong elders to sometimes take their medications or anything like that?
I think so. Traditionally in Laos, the Hmong never took very many medications, certainly like not long-term medications to treat chronic diseases. And so one of the issues we're running in with is just adherence to long-term medications. Some of the individuals, once they start taking medicines for high blood pressure and diabetes, if they do have symptoms from these conditions, once they start feeling better, they may have the propensity to discontinue the medications themselves. And so a lot of times I'm reminding patients that these conditions are changes that are lifelong, and that by taking the medicine will benefit the elder and allow them to live a healthy, long life. And that's kind of the same goal that the Hmong patients, as well as our American patients, have, is just to live a good life and a long life as possible. And so with that common goal in mind, we can usually help negotiate, as well as help our patients kind of come to understand the importance of these medications. Sometimes perceptions of certain procedures are a little different in the Hmong community in terms of thoughts of surgery being invasive into the body. Some Hmong hold the belief that the body is kind of like this sacred vessel that is to be tampered with as minimally as possible as it dwells in the living realm here on earth. And as the spirit passes into the spiritual realm, you want to minimize surgeries and damage to the body. I've even run into some cases with my own patients who really resist surgery, and we have to do long discussion sessions about risks and benefits and the goals of our procedure to help the patient, to help them come to an informed decision. And then we have to respect that decision, what they make, even though it may not be our ideal standard of care that we provide. I find that we can still provide some benefit to the patient, even though they don't choose the place.
Fantastic. Well, Dr. Thao, thank you for your service and being a leader in your community. I'm sure it's a wonderful experience being able to take care of everyone like that.
Yeah, it's interesting being from the Hmong community, growing up in the Hmong community, and then also with 1 feet in, just Midwestern American society. You kind of feel like a pioneer a little bit, being, a part of the community that kind of traverses both cultures. And I find really great things about my own Hmong community, as well as my Midwestern community as well. So it's one of these things that I try to facilitate a trading of good aspects of both cultures and communities. And I find that overall, by probably just happenstance through American immigration policy, the Hmong landed in this kind of cold land in the heart of America, where it was very different than the high mountains in a tropical climate in Laos. Although the similarities that we find, really welcoming people, hospitable neighbors, good socioeconomic conditions, very good jobs for individuals, certainly in the 1980s and 1990s, was what allowed the community to really make a home here. for 40 years and not leave places like central Wisconsin as well as the Minnesota area. So I think the community has learned to really kind of embrace the land and the culture. I think the folks here have also learned to embrace the Hmong community as well. And so now we're just part of the community, just the fabric of what makes America and Wisconsin so great. And so I'm just happy to be part of that. It's really awesome.
Amazing. Again, thank you, Dr. Thao. I can imagine it'd be hard to, stay true to your cultural roots, migrating to a new country, but it sounds like you're making the best of both worlds on that one.
Mm-hmm.
And I do have one last question about some advice to future Hmong physicians. I've had the pleasure of interacting with many Hmong students that are up and coming and really looking for careers in medicine. So do you have any advice for them in the future?
Yeah, I would say, just embrace it and enjoy your journey in your westernized medical training. It's great. I really valued the way that we were trained to think about medicine, healing, diagnosis, the story that we get from our patients. So in the short time, the 3 to 4 years that you spend in medical school, just enjoy that. And also know that will build upon your further learning if and when you want to serve communities who are, different from your standard patient population in terms of diverse and diverse and marginalized communities. Wherever you go, whether it's the Hmong or other communities, there are individuals that are in such need of care. And so if you do have interest in serving the Hmong, just know that there are networks of mentors that can reach out to you, as well as resources that you can now find in terms of books, lectures, digital information that will give you a hand in caring for your Hmong patient. As well as other ethnic minority groups in the US. And so I encourage you to really explore that as well in medical school as well as beyond, because you may be a physician that with your background or just your interest or your training in medical school, be a really ideal candidate to work in the Hmong community or to work in a rural community serving individuals in a small clinic or in an urban community, or to work with the migrant and seasonal agricultural workers that we have in Wisconsin. And so, beyond the confines of the medical school, there's really just a whole world out there of diversity. And I encourage you to just embrace that as well as you finish and just explore your passions. And very likely, wherever you go as a physician, you will be needed and you will make a difference in your future role.
Awesome. Thank you, Dr. Thao, for speaking on all these points and taking the time out of your busy day to speak with us today.
Yeah, well, Andrew, it was really great talking with you, and don't hesitate to give me a call or a message again if you need anything else.
Absolutely. Thank you very much.
All right, you take care.